COVID-19 cases are down in Minnesota and Wisconsin, but are skyrocketing in other parts of the country.
Some states in the South and West are seeing their highest numbers yet. Susan Elizabeth Littlefield looks at what that could mean for us.
The CDC just had this forecast come out saying, in certain states, they expect more people to die in the next 4 weeks than they have in the past. Can you explain what's happening in those states?
We just have to be honest and admit we don't understand why some states are seeing major increases in cases and in fact have been described as on fire with this virus, and other areas still decreasing. What we do know is that the general trend has been everywhere in the country. We're seeing increasing cases. 2 weeks ago, 17 states, including the District of Columbia, were seeing increasing cases. Today, that's at 29. And where we've seen the big change is from states that had been reported decreases and now moving into either the level or increasing areas. So this is just what this virus is going to do, and it's not that unexpected.
Well, I know one thing we had talked about. Georgia was, the first to kind of go back to reopening, and they're not on this list, which is interesting.
Yeah. Well, first of all, this list looks at the areas with the highest increase that we've seen in terms of overall numbers. I would urge people not look at one state and try to make a judgment, because you just can't. I think one of the things that's telling is originally it was touted as these are the southern states where the temperatures have been warmer, maybe people are indoors with air conditioning, and yet you look at Northern California, Oregon, Washington, Idaho, Montana, Wyoming, all seeing increasing cases right now, where there surely has not been a major impact from air conditioning. What you're witnessing is just what this coronavirus is going to do, and this is what we described in a document put out by CIDRAP more than 2 months ago, that there would be different scenarios that might play out to get us from the 5 to 7% level of infection in this country to what very well may be 60 or 70% before the virus slows its transmission down. And I think right now what we're seeing is just that. It's a variety of different reasons, whether it's outdoor activities that have very low risk versus indoor activities, restaurants, bars with much higher risk. We just don't have all the answers yet for what's happening in each of these areas.
I want to ask 2 more questions, Minnesota related.
Okay, fire away.
Have we peaked in Minnesota?
First of all, no one's peaked. No one. Because a peak implies that somehow you hit the top of the number of cases. We clarified our scenario document that we published several months ago, where one of the potential ways in which this virus could move from the 5 to 7% of the population infected to the 60 or 70% was following an influenza pandemic model, where you would have a first wave of cases lasting several months, and then regardless of what humans did, we'd see a trough where there'd be very few cases. That is what historically has happened. We've now come to the conclusion that's not what's going to happen here. It's one of our other 2 scenarios where this is just going to keep marching like a forest fire. And as long as there's wood to burn, meaning humans that are not yet infected, it will find you. And so I think the point is that just like the other states that are now seeing this major increase in activity, there were those who described them as having peaked their cases back in April or even early May. And now look what's happening to them. So everyone can expect that the activity we've seen to date is just the beginning. Again, I can't remind people enough. We're talking about 5 to 7% of the population has been infected to date. Think of all the pain, suffering, economic disruption, and deaths that have occurred for 5 to 7%. We're on our way to get to that 60 or 70% level. We have a lot more to go. So anybody that talks about a peak today doesn't understand that we have an incredible journey ahead of us yet.
As you well know, we are reopening here in Minnesota. We've done a fair amount of it. We're sort of on the later end. Is there anything we can do in Minnesota to not become one of those states that's seeing a surge?
Today's society has voted with its feet to say we are experiencing pandemic fatigue. We don't want to be shut up. We want to be out and about. And when that happens, clearly we increase the likelihood that people are going to transmit to other people. You're seeing that in these other states. So that's still something we have to be mindful What we're trying to do, though, is craft a way to say we don't lock down. That just not only destroys our economy, but it really, in a sense, destroys society. At the same time, we can't let this go willy-nilly. I mean, we've got places like Houston right now that are about ready to take over the role as the worst city in the United States, even beating New York City. We can't let that happen. So somehow we've got to find that combination of when cases start to increase, that we do really support the distancing issue. I can't say it enough. It's like real estate. There's 3 words that we must never forget in terms of prevention here with this virus. It's distance, and it's distance. So avoid large crowds, avoid indoor activities where there are multiple people around. This is what we're going to have to do. And if you don't, this virus will find you. And for many people who are younger, it won't be a life-threatening infection. But many of those younger people may transmit the virus to their parents, to their friends, who will be a life-threatening infection. And that's what we've got to understand right now.
What about masks?
At this point, we know that the N95 respirators, the ones that the healthcare workers are using, and we surely need to save them for healthcare workers, can be very efficient and highly effective in reducing the one's risk. Surgical masks are less effective, and we really don't understand how effective cloth face coverings are. At this point, I would say use whatever you can in public. But just be mindful again that it's about distance. So if you have a face covering on, don't assume that that's going to protect you beyond some marginal value, and you have to keep remembering its distance. The other thing, if you're going to wear a mask of some kind, meaning a surgical mask, which again I hope we can reserve for our healthcare workers where we're short of those too, or a face cloth covering, at least wear it so it might be effective. And what I mean by that is we've actually been doing a survey of looking at the television news and looking at shots that are taken in crowds, and then freeze framing that and looking at to see how many people are wearing face cloth coverings and how do they wear them. 25% of all the people wearing something today wear it under their nose, meaning it's like fixing 3 of the 5 screen doors on your submarine. If you're going to wear it, at least wear it so it might have some effective use. And right now, we're not seeing that. If there's any message that I can get across to the citizens of Minnesota, is that we have a long ways to go yet. I know you don't want to hear that, but you've got to get yourself in that mindset. What are we going to do to get from that 5 to 7% of the population already infected to a much, much larger number? And that's going to take all of us working together. It doesn't mean shutting down. It doesn't mean that at the same time we let this virus go willy-nilly and literally bring down our hospitals. We've got to find that way to thread the rope through the needle in the middle, which means a combination of some outdoor and indoor activity, but also we are mindful of the seriousness of this pandemic.